Hello, everybody. Thank you. Good evening. Thanks to everybody for inviting me to North Dakota. It's a lot different than from California, where I live. And I'm not from California, though. I'm from Chicago. I know what the weather is, so it didn't terrify me too much when I heard about it, although I did have to admit I bundled up because I've been in California for 20 years. So, okay. Well, it's a great pleasure to be here. You have to be a little bit tough, I think, to live in North Dakota, and that's good. We're missing some toughness in this country. And I think our public has been damaged by really failure of leadership at many levels. And so what I'm going to do here tonight is go through a lot of data. It's sort of a semi-academic talk, but I'm going to go through a lot of information. And my guess is it will make everybody say, yeah, I thought that was true. But it's good to know the information, to see the actual data, and to be armed with the information. Because although you're not going to win many arguments these days with people who have been really psychologically damaged, and we're in a country where facts don't matter to many people. We can't have a society like that. So I'm here to present you with the facts. Now, what happened? And that actually was the first question. When I left, I was in Washington for only 4 months, and I came back in mid-November of 2020 from starting in late July 2020. And the first thing I said when I got off the plane at the airport, my wife picked me up, I actually said, what happened? But I was talking about like my whole experience. It was surreal because I'm not a politician. I would never want to be a politician. And I think anyone who ever saw me speak knew that I was not there for political reasons. So I sort of wondered what happened. Well, in terms of what happened in the pandemic specifically, there were several claims made about the virus by the World Health Organization early on. We're talking about February 2020. And those claims were wrong. They were exaggerations. They were incorrect computations of the fatality rate. The risk to die was grossly incorrect and frighteningly high. But if you looked at it for 10 minutes as a medical scientist, you should have known that because it's a fraction. And the bottom number in the fraction was really the way they did it, the people who were so sick that they needed to seek medical attention, whereas we knew anyone who was even remotely associated with medicine knew that there's a lot of people that were infected but were not so sick. And that made that bottom number of the fraction much bigger. So the fatality risk, the death risk, would not be as high as what people said, but they said it. And then the computer modelers came out and made all of these grossly erroneous assumptions, denying all history of viruses, how viruses come on and then they come down naturally. And this was then communicated to public health leaders in our country and on TV. And I put leaders in quotes because they're failures. They were grossly incompetent, and they still are. And they misled the public for a variety of reasons, as I talked about in my book. And then the media came into play. And in the United States, they amplified these numbers repeatedly, over and over again. We were inundated with this on TV and in the radio, and that was very poisonous, and I'm going to show you some examples of how that worked. What was claimed was that the virus had a far higher fatality rate than the flu by several orders of magnitude, that everyone had a significant risk to die, that no one had any immunity because the virus is completely new, that everyone was dangerous and spreads the infection, that asymptomatic people are the drivers of the spread of the infection, that locking down, meaning closing schools and businesses, closing people into their homes, confining people so they couldn't even see their relatives, stopping non-COVID medical care, and eliminating travel, they said would stop and even eliminate the virus. They said masks will protect everyone and stop the spread of the infection, and they said that immune protection is only from a vaccine. And every single one of these things is false. It is completely false. We knew it was false then. I said it was all false, and I was right. The pandemic policy from the beginning was announced by, I think, Dr. Deborah Birx. Dr. Birx was the person that on the White House Task Force. In fact, she was the head of the medical side of the White House Task Force. Dr. Birx wrote all of the federal guidance to every single governor. Dr. Birx visited dozens of states. This is for 6 months before I walked into Washington, during the 3.5 months that I was there, and after I left, she was the official purveyor of White House Task Force guidance. Not me, not President Trump, no one else but Dr. Birx. And in that advice, in the beginning, she said, flatten the curve. That was the idea. The idea made sense to most people, and I thought it was reasonable because the whole point was we needed to make sure the hospitals weren't overcrowded. So there was never an intent to stop the infection. There was never any evidence or any mention of reducing deaths from the infection. It was literally only to stop overwhelming of the hospitals so that people could be taken care of, including non-COVID patients. That almost immediately, though, morphed into something very different. It morphed into stop COVID-19 cases at all costs. And that was the advice from Dr. Birx and Dr. Fauci, who everybody thought was in charge, but really wasn't, but he was the most visible person on the media and the most visible face of public health policy to the media. And they advised all the governors. And like I say, almost the entire country implemented that advice. That was what I call the Birx-Fauci lockdowns, the Birx-Fauci restrictions, the closures in almost every state. And the result of that policy is that more than 900,000 American deaths have been attributed to the virus alone, and millions of families and children were severely harmed from the lockdowns, from the closures, and I'm going to show you that data. And sadly, especially lower income families, working class families, and the poor, their advice killed people and destroyed millions of people. And that means that when you hear people like that try to blame others, like me and other people who were opposed to what was implemented, for the failure of what was implemented, that is another one of these Orwellian statements that we are living through. The lockdowners own the outcomes, period. They're trying to run away from accountability and responsibility for the failure of the policy to stop the spread of the infection, from the failure of their policy to stop people from dying, and from the massive harm that they imposed on Americans. Now, first, we have to know from the beginning the data was flawed. Why do I say that? Well, the PCR testing, the timelines and trends, and what was called hospitalizations and deaths, quote, from COVID-19. Here's some examples of this. This is fact. This is not opinion. This is a study published in 2021 that showed that the various sensitivities of PCR testing to live virus. Now, just as a very brief thing, a cycle threshold is numbered 35 here, means that it takes 35 averages, basically, to detect the virus. That's all you have to know. The machine stops if you detect it at 10 cycle thresholds. If you have to go to 35 to detect the virus, there's not much there. That's sort of obvious. It turns out that if a cycle threshold of 35 is used, 97% of positives are detecting dead virus or pieces of virus, not contagious people. Okay, so if you're quarantining people on the basis of a positive PCR test, 97% of them at this cycle threshold are being quarantined for nothing. They're not contagious. Was that used? Yes. The United Kingdom used a cycle threshold of 40 to 45. The United States used 35 to 40. The FDA recommended 40. Israel used a cycle threshold of 37. I talked about this at the task force. I brought in the papers to explain this to the people on the task force. They never said a word. They never acknowledged it was true. I thought none of them even knew it, frankly. Then I found out later that someone said in July 2020, I didn't get there till August, at a cycle threshold of 35 or more, the chances of it being replication competent, meaning contagious virus, are minuscule. Quote, you gotta say it's just dead nucleotides, period. That was said by someone named Anthony Fauci in July of 2020. Now, what do I mean hospitalizations from COVID-19? We were just talking about this at the dinner table. It turns out that I presented data that the hospitalizations that were being reported from COVID-19 were people mainly that had positive tests for the virus, because we were testing everybody that went into a hospital, but they weren't there for COVID. COVID is an illness. They weren't sick. They were hospitalized for something else, most of them. And then it was finally published from Stanford University's pediatric hospital in May of 2021 that roughly half of the pediatric hospitalized patients that were called COVID did not have COVID. How do I know? They had no symptoms of COVID on retrospective review of their medical charts. Half of the kids that were called COVID hospitalizations had nothing to do with COVID. They had a positive test for virus, but they weren't sick. They weren't in the hospital for that. They were in for an appendectomy. They were in for head trauma. They were in for a broken leg. They did not have COVID. The number that you hear about COVID hospitalizations is false. This is another study from Northern California. 86% of patients who were called COVID hospitalizations did not have COVID retrospectively. 86%. What about deaths from COVID-19? The CDC itself published a study in April 2021 that said that a significant percentage of people called death from COVID did not have COVID. In fact, 35% of deaths from COVID, of people under 18, 35%, quote, could not plausibly be categorized as attributable to COVID at all. The numbers you hear about the COVID deaths are false. What's the risk and for whom? The original World Health Organization estimate was 3.4%. That's extremely high infection fatality rate. It turns out the truth is, it's been documented multiple times, that the infection fatality rate, if you're under 70, is 0.05%. That's roughly the same order of magnitude as influenza, if you're under 70. Age is a very important risk factor. It turns out the mean age for death in the United States and in the world is roughly 80. 80% of deaths are in people over 65, and it turns out there's several thousand-fold difference in risk of death for young people compared to people who are old. That was never really acknowledged during the entire narrative of 2020 in the United States. It was in the rest of the world. For perspective, if you look at these countries, Germany, Italy, the UK, the USA, most countries, the median age at death from COVID was older than the life expectancy. That doesn't minimize that people died from COVID, but there's perspective here that we have to realize. It's not just age. If you're a 70-year-old, very fit person, a rancher here in North Dakota with no significant illnesses, you don't have high risk from COVID just because you're old. That's just factually, I'm not giving my opinion, I'm showing you the data here. 2/3 of the people in the United States who died from COVID have greater than or equal to 6 comorbidities. I went into the task force and showed them the data. You're supposed to be a scientist, you're supposed to know the literature here. That if you have high blood pressure and nothing else, that's not a risk factor for COVID death. They didn't know it, they wouldn't acknowledge it. I was the only one, in fact, that brought in any scientific papers into any of the task force meetings. What about the risk to and from children? This is California data. Kids get infected by the virus. 0% deaths in California of people under 18 from COVID. That's not 0 deaths, but it rounds to 0% in California of the deaths from are in kids. Just for perspective, in influenza 2 years ago, roughly 2 or 3 years ago in California, that was the latest data I could get my hands on, 5.4% of deaths in influenza in California were in kids, okay? 0% in California. This is Florida. Under 16, 0% case fatality rate. Under 30, 0% case fatality rate from COVID in Florida. It's not just that there's low risk to children from COVID, it's that kids do not frequently spread the virus. That's a fact. That's not arguable. The data was known. It's not new data, by the way. I presented this data because it was known in the summer of 2020. In the spring of 2020, it was known. From dozens of countries, including Norway, Sweden, Spain, the Netherlands, Ireland, Iceland, Switzerland, France, Australia, Germany, Greece, South Korea, the United Kingdom, that was known. We were the only country of our peer nations that closed the schools in the fall of 2020. None of the peer nations in Western Europe closed the schools because they knew the data. The fact is that schools being open are not associated with higher community transmission, and there is no high risk to teachers. Any teacher who says that there's a high risk to going into an in-person classroom is either lying or they are so stupid they should not be teaching our children. The fact is, if I was going to design a job that was low risk from COVID, I'd want to be an elementary school teacher. Okay, healthy children have extremely low risk of serious illness from COVID and almost no risk of death. Of course, if you're not a healthy child, if you have significant underlying illnesses, okay, you're high risk. I'm not talking about that. Children infrequently spread the virus to adults, and there is no special risk to teachers in schools. That argument about, oh, we must mask our kids in schools, for so many reasons, is a complete, it's shocking to hear such embarrassing stuff said in the United States of America. Healthy children do, I came to the White House and the first thing I said was, we need to open schools. Okay, this is the first thing we need to do that I was going to push for. I wasn't in charge of anything. I wasn't in charge of opening the schools, unfortunately. But why did I say open the schools? Well, healthy children do not have a high risk from the virus. The harms of closing in-person schools are enormous. Any parent knows that. You don't just learn your book stuff in school. You learn socialization, conflict resolution, physical activity, how to interact with people. And there is nothing, in my view, more important to any civilized society than educating children. And if you don't believe that, there is something wrong with humanity. Now, online learning is a gross failure. That was known in the spring of 2020. It's not because people don't have enough broadband access. Even this country with the most broadband access in the world, which is Netherlands, the Netherlands showed their data, and there was a significant drop in performance. In the United States, F grades exploded in the spring of 2020. In Stanford University's Education Center, they started their conclusion of their study by saying, quote, findings on learning losses are chilling from looking at what happens when you close schools. All of these things are far worse for minorities and the poor. For a country, for a political party that claims to care about poor people, where were they here? I always said the lockdowns are a luxury of the rich, and I'm going to get back to that, okay? Because the people that are rich, that can form their little micro schools with their PhD neighbors in the neighborhood I live in, they don't care about the lockdown. But the regular people, the working people of this country, they can't have a lockdown, particularly for their kids. We closed our schools. This is the biggest sin of the COVID pandemic. America is a disgrace for closing the schools. I'm sorry to speak so abruptly, but that is a disgrace. And the reason it's a disgrace is because we knew. It's not news now. If you read in the New York Times or, at the Atlantic, I don't know how many people read that stuff. I don't. But I see what they say, that, schools, they should be open. We knew that in the spring of 2020. What happened when we closed the schools? This is the bottom line, zero baseline line of how many medical claims were in 2019 in teenagers, okay? So it's a relative percentage I'm gonna give you. 2020 versus 2019. 2020 is the year of the lockdowns. There was a drop over the year in the overall health visits to doctors for teenagers because medical care was stopped. People were not just told you shouldn't get medical care, they literally wouldn't do what's called non-essential care. Of course, that was critical care that they were, and I'm going to go through what they didn't do. But they also inculcated a lot of fear in people. People were afraid to go and take their kids in. So there was a drop in all medical claims. Mental illness claims in teenagers skyrocketed. That's not from the virus. That's from the lockdowns, from the isolation. Self-harm visits compared to 2019 in blue here, doubled, tripled in teenagers. Self-harm visits to doctors, that means little kids putting out cigarettes on their skin. Okay, this is very graphic, but it has to be said. We cannot pretend that this stuff didn't happen. Psychiatric illness in college-age kids exploded, anxiety disorder, depressive disorder, from the lockdowns, from the policies that human beings voluntarily said need to be put in place. Drug abuse in teenagers skyrocketed, substance use disorders and overdoses compared to 1 year before. There was massive psychological damage that I just said, including 1 of 4 college-age students in the United States thought of killing himself in June of 2020 from the lockdowns. When you close schools, in the spring of 2020 alone, we missed almost 300,000 cases of child abuse because the schools are the #1 agency where child abuse is noticed. 35% increase in severe child abuse visits to the emergency room. Okay, I've been a doctor that has to go in the middle of the night and decide, does the kid, the baby, go home with the parent by looking at the head CT scan? Or is this a shaken baby or a child abuse case? The police standing right there, you have to decide. I know who comes into the emergency room with child abuse. Parents bring in their kids for child abuse when they think they killed the kid. When there's an explosion of 35%, can you imagine what's being done in the homes where people are not being brought into the hospitals? Mandela said there can be no keener revelation of a society's soul than the way in which it treats its children, and the United States has grossly failed that. Now let me talk about lockdowns. What is a lockdown? And the reason I'm saying this is because I went into a meeting in the White House, and Dr. Birx, in, say, October 2020, after me being the only one who talked about the harms of the lockdowns, where these other people on the task force were focused on, like I said, stopping COVID-19, period, no matter what, which they failed to do. I said, well, but what about all this stuff? Because it is unethical for anyone in public health to talk about a public health policy to stop a disease without talking about the impact of the policy. I mean, you don't have to be a genius to understand that. This is obvious, right? So they didn't, but they knew it was a dirty word by the time I was, say, October 2020, talking about it all the time. So Dr. Burke said, no one on the task force is for a lockdown, Scott. This is in front of a room full of people. And I said, oh, are you for closing schools and businesses? Yes. Are you for limiting medical care for non-COVID illness? Yes. Are you for limiting groups and activities of families? Yes. Are you for restricting personal movement, curfews, and quarantining asymptomatic people? Yes. I said, then you're for a lockdown. And that was the end of that discussion. Might have been the last meeting she came to. But what did the lockdowns do? The lockdowns failed. Why do I say that? Because that's what the facts show. The lockdowns failed to stop the spread of the infection. They failed to stop the dying. This is a study of 24 European countries published in March 2021. The paper says that more severe lockdown policies were not associated with lower mortality. In other words, the lockdowns have not worked as intended. They did not stop the deaths. This is a study from Stanford, January 2021. We do not find significant benefits on cases being limited from the more restrictive lockdowns. In fact, Johnny Anides, one of the authors of the study, was quoted afterwards as saying the lockdowns were often, quote, pro-contagion. They increased the cases. Now you say, why would that happen? That's because they were telling people, remember, don't go to the beach, don't go to the park, stay in your home. The cases spread indoors. The cases don't spread in the park, on the beach. The big eye-opening study that everyone should be aware of is a study in June 2021 by the Rand Institute in USC. They looked at the lockdowns in 43 countries and in the United States. And what they showed is the longer the lockdowns were in place, more deaths occurred. More. This is excess deaths. This is deaths from all causes. Deaths beyond what would happen without a pandemic. So COVID deaths plus all the other deaths. The longer they were in place, more deaths occurred. The earlier the lockdowns were put in, more deaths occurred. And in the 43 countries with available data and in the United States, the deaths were coming down before the lockdowns were put in place. And when the lockdowns were put in place, the deaths started rising. The lockdowns killed people. This is the latest study that was in the news recently, January 2022, from Johns Hopkins. And they looked at thousands of studies from the world's literature on the lockdowns. And all you have to know is their study quotes, the lockdowns have had little to no effect on COVID-19 mortality. The lockdowns have had little to no public health benefits, but they impose enormous economic and social costs. And finally, lockdown policies are ill-founded and should be rejected as a pandemic policy instrument. This was known in years before this pandemic. The lockdowns were, in the pandemic literature, always rejected because they don't work and they're destructive. That data, all that stuff was ignored. That wasn't news, that Johns Hopkins thing, by the way, about the cost of the lockdowns. This was a study that I wrote May 2020. I wrote a paper on the cost of the lockdowns with other people because the economic, there was a false dichotomy put forth to the public that if you're saying the lockdowns shouldn't be done, you're choosing money over lives. The economy over lives. This was the mantra. It turned out that was a lie, an overt lie, because there were decades of data in the economics literature that when you have a severe economic downturn, people die. There is a life years lost to economic downturns. That was known. It was lives lost versus lives lost, yet no one. I work at Stanford University. There's a lot of famous economists there. They were silent. I was called up by an economist at University of Chicago named John Burge. And he said, Scott, you're out there on the lockdown harms. Let's write a paper and quantify what's going on. And what we found in May of 2020 was that the life years lost from the lockdowns was double the life years lost from COVID virus deaths. So this is not new. This was known then, and we continued that policy. When I said the lockdowns killed people, how could they kill people? Because the fear and the rejection of medical care alone killed people for non-COVID patients. Half of the 650,000 US cancer patients on chemotherapy, half of them said, I'm not getting my chemotherapy. It's too dangerous to go into the hospital. 40%, 50% of stroke patients and heart attack patients didn't call an ambulance during the spring and summer of 2020 because of fear. 85% reduction in organ transplants from living donors. The need for the organs didn't go away. 2/3 or more of cancer screenings didn't get done in the United States. These people came back now. They're either going to die, they had cancer, or they're going to come back with metastatic disease, with spread. Severe childhood is already mentioned, and ironically, most childhood vaccinations that we believe in were skipped during the pandemic. During the first 2 months of the pandemic, we're talking about spring of 2020, more than 1/3 of the United States excess deaths were not from COVID. They were lockdown deaths. That was known in the summer of 2020. I said lockdowns were a luxury of the rich. This is an example. High-income jobs during the first year of the lockdown. What happened? No change, minimally increased in employment. People at the low end of the wage scale, 23.6% job evaporation. When people lock down the United States, they harm the rest of the world. Okay? We have people that care about global impact of things, as you may have heard. We interrupted the medical care and the supply chain, the Western world, the United States and the Western world, to the poor countries. 400,000 new deaths from tuberculosis alone during the lockdown. Tens of thousands of babies with malaria died in 2020 because they couldn't get the malaria nets and these very basic things. 1.5 billion children in the world were shut out of their education in these poor countries particularly. And this is a statement that is really devastating. More than 100 million more children during the lockdown suffered sexual abuse and exploitation, violence, genital mutilation, and childhood pregnancies because of the lockdown. Thank you. When you drop the income and the GDP in poor countries, they're not the United States. Their life expectancy goes down immediately. They're borderline, these countries, right? 97 million more people were thrown into severe poverty in 2020 from the shutdown. And what I mean by that is they live on less than $1.90 per day, okay? 30 million people in India alone were thrown from middle class into poverty for the lockdown. There was a study that talked about the impact of the lockdown in 124 countries. Their conclusion was that 1.2 billion life years were lost due to the lockdown mobility restrictions, 25 times as much as due to COVID-19. That's the science on the lockdowns. You'll hear that phrase frequently. You've heard it over the year. There was an alternative. That's called targeted protection. John Ioannidis wrote about it. David Katz wrote about it in the New York Times in an op-ed. former founder of Yale's Disease Prevention Center, and I wrote about it in March of 2020. Martin Kulldorff, a very famous epidemiologist, excuse me, sorry. Martin Kulldorff tried to write about it in the United States. He's a Harvard professor at the time in epidemiology, one of the experts for consulting to the CDC and the FDA. He couldn't get his paper published in the United States. My paper, the first paper I wrote in March of 2020 on the damage from the lockdowns and the fact that we should use targeted protection, which means increase the protection of the high-risk group. It doesn't mean let the virus spread. It means increase the protection of the group that we know has a risk to die and stop destroying everybody else. That's what targeted protection is. I wrote that paper and the Wall Street Journal rejected it and said, oh, we have, this stuff is all known, it's been said. So I had it published in a paper called the Washington Times. Finally, about 7 months later, something called the Great Barrington Declaration was written in October. And that's very important because it was written by Jay Bhattacharya, Martin Kulldorff, and Sunetra Gupta from Stanford, Harvard, and Oxford, institutions which I used to respect. And that gave some credibility that it just wasn't a few people saying this, because it turned out about 1 million people have signed on to that, including about 60,000+ medical scientists, public health scientists, and medical practitioners. Now, what does targeted protection, who says that would work better? Well, remember, the burden is on the states that did the lockdowns to be better. The burden is not on the states or the countries that didn't do the lockdowns, because the states or countries that didn't do lockdowns did not inflict the enormous collateral damage on people. We have an internal control in the United States, and that's Florida. Now, I know that the Dakotas did not severely lock down, okay, but you know, people want to have a big state with a lot of urban-rural population mix, a lot of ethnic heterogeneity. So I'm picking Florida because it's very similar to my state of California in all those ways. Large state, a lot of heterogeneity in the economy, in urban-rural populations, etc. And even similar weather, although obviously weather in California is a lot better than Florida. But we look at the states, and Florida has something that's very different from California. The age. Florida is one of the oldest states in the country. California, in fact, Florida is the 5th oldest state in the country. And California is the 6th youngest state in the country. Why does that matter? Because COVID generally kills old people. That's states by median age. This is states by percent of people over 65. Florida is the highest, the oldest state in the country. California is a very young state. California's got a big advantage over Florida for COVID. Well, after a full year, what happened? A full year of the pandemic. Florida outperformed the country in COVID deaths per capita and outperformed 25 states. Florida outperformed by excess mortality increase the country and 2/3 of states. And age-adjusted COVID mortality, Florida outperformed the country and 40 states. You're never going to hear that on CNN, but I doubt anybody in here listens to CNN. Florida versus California, it's relevant here because Florida opened up in the late summer 2020, all the schools, and no mandates and restrictions on these things. California is one of the most stringent COVID policies in the country. This is green from the fall of 2020, means schools are in person. This is Florida. This is California. Look at the little sliver of green for in-person schools, 17% of kids. How'd they do? Florida versus California. Florida did better in COVID mortality. Florida did better in excess mortality after the first year. You're not going to hear Governor Newsom say that in California. At the end of the summer, you may remember, of 2021, the newspapers went crazy. Look there's cases in Florida. There's a surge in Florida in the South. And I wrote my book at that time. I was writing the book, and I said, well, the odds are, I said, the cases are going to come down, and the cases are going to go up in the rest of the country. And that's exactly what happened in the fall of 2021, with the high yellowish, whitish color here being a lot of cases, and the dark parts being very few cases. How did I know that? Because that's exactly what happened in 2020. It's not news that the cases start in the United States in the South and then spread to the rest of the country and come down in the South. This is not a cause for panic, but the media wants to say that Florida did worse. Here's the data as of now. Throughout the entire pandemic, excess mortality increased, California versus Florida. California ranks 34th out of the 50 states with 18.6%. Florida ranks 19th best with 15.6%, and they beat the country's average. Now remember, Florida does not have the burden to do better because they didn't kill people with the lockdowns. They didn't destroy families. They didn't put massive harm on our kids by closing schools. The burden is on the states that did the stringent policies to prove that it worked, and they did worse than Florida. This is New York. New York did worse than Florida in the pandemic. This is age-adjusted COVID mortality for the whole pandemic by state. This is the US in gold here in the middle. Florida did better than the country, and they were open. So the fact is that the lockdowns did not work, and Florida did better than most of the country with opening up. I'm going to talk about vaccines now, because this is sort of the big topic these days, and it's a very important topic, because the insanity has continued with the lies, the misinformation by our public health leaders and our leading public health agencies. I look to other countries for the data. I never thought I'd say it, but I don't trust the data coming out of the United States and the CDC. And in fact, the era of trusting people just because of their credential or the degree after their name should be over for everybody. We need to be thinking critically for ourselves and make decisions for ourselves and our families. And with that comes the responsibility of knowing what you're talking about, right? And so that's a burden. The burden is not to be taken lightly. You have to familiarize yourself with the facts. It's not that complicated. This stuff is not only not complicated, it's a lot of it is simple logic, as I've shown, and I will get to with the vaccines. This was a study that came out of Israel after the summer of 2021 on the vaccines. And why? Because they did a lot of vaccination there. And it turned out that the vaccine was only effective after several months of blocking COVID infection, symptomatic or not. COVID infection, only 39% effective. So we knew back then the vaccines did not work to prevent you from getting COVID. But they were highly effective in stopping severe COVID or death for 6 months. Okay, this is in the people that have a high risk to die. This is Qatar study, October 2021. Now you'd think, why would we be in a position of looking at Qatar and trusting them? Well, Qatar has actually been very forthcoming with their numbers. They vaccinate almost the entire population, so it's a good study for us to look at. Effectiveness against any infection, mild or not, after 4 months drops to negligible, the vaccines. Okay, there's a temporary impact, less than 20% effective against any infection. Against death, for the 6 months they did the study, very high protection from the vaccines. This last number here, these are error bars. which means they had so few people at that point that you have to disregard it because the number could be anywhere in that range. So basically, it's very high for 6 months in the Qatar study. I'm showing you the actual chart from the paper. This is not an opinion. I'm showing you their data. There's a study here from Sweden, October 25th. 9 months worth of data. And what they showed was that the effectiveness of the vaccine against symptomatic infection dropped very severely after 3 or 4 months. But against death, it was very good for more than 6 months in people who are under 80 years old, protected against death. But it starts dropping down for people over 80 after about 6 months, down to about 50%, protecting against death. This is the vaccines. This is another study from Israel on the vaccines comparing, the question is, do people who've had COVID need the vaccine? That's the question. We're the only country denying the fact that has been established for centuries in infectious diseases and for decades in other viruses and for years now in this specific infection that there is significant protection immunologically against the consequences of COVID if you've had COVID. That's a fact. That's not deniable, it's not arguable. Anybody who denies that, you know, I don't even know what to say about that. But this is the data from Israel. You take two groups of people who've had COVID and people who've been vaccinated and never had COVID. The protection of people who've had COVID is 27 times higher against a symptomatic infection compared to people who've been vaccinated, much higher. The protection of people who've had COVID is 13 times higher than people who've never had COVID but been vaccinated against any infection, whether it's symptomatic or not. And against hospitalization, which means significant COVID, severe COVID, there's an 8-fold higher protection of people who've had COVID. So people who've had COVID are much more protected than people who've never had COVID and been vaccinated. That's a fact, it's not arguable. And then they looked at the people who've had COVID but not been vaccinated and people who've had COVID and then got vaccinated to see, do people who've had COVID benefit after that from getting vaccinated? The answer in this study is no. There is no difference in the incidence of getting COVID again if you've had recovery from COVID and never been vaccinated versus if you've had recovery from COVID and then been vaccinated. That's their data. Sweden. Not Sweden, that was Israel. This is another part of another later study from Israel. It turns out that protection against a new infection is the same of people who've had recovery from COVID or recovery and then vaccinated or vaccinated and then infected and recovered. They're the same. There is no difference of getting a new infection if you've had COVID, whether or not you've been vaccinated, meaning of all people who've had COVID. This is the data on protection against severe COVID, because the reality is this is really what counts. You know, it matters a lot more to me if I'm protected against being hospitalized or dying than if I'm protected against getting a fever for 24 hours. Okay, that's not the same thing. So we look at this, protection against severe COVID. And the three categories of people have equivalent protection: recovered but never vaccinated, recovered and then vaccinated, vaccinated but then infected and recovered. For a subsequent infection with severe COVID, they have equivalent protection. Their data says there's no reason to get a vaccine if you've had COVID. And that's the chart showing the increase in cases over time of people who've been vaccinated but never infected. You see how it's going up, versus the people who've had COVID with or without being vaccinated. There's a big difference. This is the more recent study from Denmark. This is about Omicron. Pfizer vaccine, Moderna vaccine. This is their chart. And I'm just going to show you the bottom line here is that after 2 months, the effectiveness of getting an infection with Omicron is between 4 and 9% effective. It's essentially zero. The vaccines do not stop Omicron infection. So the data on the vaccines can be summarized as this. In people who have a significant risk to die, they protect fairly well. The protection against infection becomes very low after a few months and is nearly zero against Omicron after 60 days. They do not protect against a new infection or a symptomatic infection as well as the immunity from having COVID. That's factual. These vaccines cannot generate any kind of herd immunity, public protection. The fact is that the vaccine offers personal protection for you if you have a risk to die. It does not stop the public risk of infection after only 60 days or 90 days. There is not a public health danger of people being unvaccinated. If you're vaccinated, you're protected against dying if you have a risk to die. You don't care if the other guy got vaccinated. That's his choice. There is no case to mandate vaccines for the population as a whole from this data that I've shown you. Now that is not the whole story though. There are serious safety concerns from the vaccines. We have not been given the information. There's been a very poor transparency of information about the safety issues with the vaccines. This is one of the biggest scandals of the pandemic and of the CDC for not showing the data, for not showing the side effects. And we know that things that are serious can happen, particularly in young males with myocarditis, heart inflammation. And that's with the knowledge that young people that are healthy do not have a significant risk for a serious illness from COVID. That's not deniable, that's fact. So there's a risk-benefit equation that everyone does in every single thing in your life. Are we in a country where we have a government pushing vaccines for young, healthy people that do not have any significant risk from the illness, but they have a risk, even if it's anything greater than zero, it's unacceptable from the vaccine. And the answer to that question, do we have a country like that, is yes, we do. In fact, we have a university leadership all across our country that is requiring healthy college-age students to get vaccines and some of them boosters and testing twice a week. That's what's going on. Every college president who's doing that should be fired immediately because this is grossly unethical behavior endangering our children. This is a quote that I never thought I'd read from somebody in the United States of America. This is the editor-in-chief of the New England Journal in October of 2021, said, quote, "We're never going to learn about how safe the vaccine is unless we start giving it. That's just the way it goes to children." I mean, this is unconscionable. And we are not like other countries. This is what people have to understand here. Our country is off the rails. This is the United Kingdom from September, about the same time, where their vaccine recommendation committee to their government said the margin of benefit is too small to support advising vaccination of otherwise healthy 12 to 15-year-old children because the risk from the illness is so low. Now, part of the reason why so much of America is broken psychologically is because of the media. Our media is poison. I think we all know that. But I'm going to show you factual data that it's not the same in other countries. This is a study at the end of 2020 that looked at all the studies about COVID in the English-speaking media in the US versus non-US. In non-US English-speaking media, 54% of stories were quantifiably negative about COVID, about half. In the United States, 91% were negative about COVID. About schools reopening, the same thing. Slightly more than half were negative by their quantifiable terms, by these researchers, outside the US. But the US media, 90% were quantified as negative. In the United States, media in 2020, from their study, stories about increasing cases of COVID outnumbered stories of decreasing cases by a ratio of over 5 to 1, even when the cases were going down in the United States. The media has distorted, inflamed, and really put forward a tremendous amount of harm to the public good. We cannot have that. We must make them accountable for what they're doing. The sinful legacy of the media and of the leadership of public health in the United States is damaging the younger generation. The fear in the younger generation, this is college-age people and people 25 to 34, the fear of incurring a serious illness from COVID is enormously exaggerated compared to the real risk to them. Whereas people that are over 65, their estimate of serious illness is about the same as what it really is. There's a specific damage to the younger people in the United States. In one survey, 18 to 24-year-olds, 50% of them said they were nervous about all social interaction. People have put on weight during the lockdowns, but the biggest problem is in the 18 to 24-year-olds. More than half of people in the United States, age 18 to 24, had an unwanted weight gain during 2020, and that unwanted weight gain averaged 28 pounds. I mean, that's obesity. When you put on 30 pounds of fat, you know, that's bad for it, right? I mean, this is ironically the biggest risk factor for serious illness from COVID, of all things. Yet, you've never heard the public health leaders on TV talking about make sure you're not going to gain weight, to make sure you have a healthy lifestyle. Even when they're talking about COVID, they should be talking about this. We don't have an idea of the extent of the damage to the younger generation here. It's going to take decades to dig out, if we can at all. And that doesn't count, by the way, what we're doing to our children in schools. Can you imagine, and I'm sure you have thought about this, what we're creating with young children, forcing them to wear masks, thinking that they're a danger to everybody and everyone's a danger to them. I mean, I don't think that's even, you're not even able to anticipate what's going on psychologically there. Now, I want to talk about the universities briefly. I'm almost finished now. I'll take some questions. The universities are a disaster in the United States. And this is the story of my university, Stanford University. This is a story where there were 3 medical scientists at Stanford University. Johnny Anides, who's a very well-known epidemiologist, me, and Jay Bhattacharya, 3 medical school professors. I was in the medical school for 14 years there. We all said the exact same thing for months about who's at risk and who's not, about the low risk to children, about immunity after getting infected, about the lack of efficacy of widespread population masking. We said the same thing about the schools should be open, that the lockdowns were the wrong idea. And we all said we should be using targeted or focused protection. But only one of these 3 got a censure from the Faculty Senate of Stanford University. I wonder why. Now, these are people, these unhinged Stanford University professors, see things through a political lens, and therefore they assume that everybody else is doing things for political motivations. I went to the White House for one reason. The policies were failing and people were dying. I didn't care who asked me to go. They assume somehow that it's wrong to help your country if it's for a president that they don't like. And that to me is outrageous, and it has to be called out. Now, how do I know that it's political? Stanford has its own zip code where people live, and you have to be a Stanford faculty to live there. California went 2-1 in voting Biden versus Trump. Stanford went 94.7% Biden, 3% Trump. Okay, there's a massive little distortion there. Again, it's undeniable. After this letter from these people at the medical school, only one medical scientist, none at Stanford, stood up and said and defended me. Not one medical scientist at Stanford. That was Martin Kulldorff at Harvard, who wrote into the Stanford Daily at the end said, I would be delighted to debate this with any of the 98 signatories. How many do you think took him up on that challenge? 0. There's a reason why I'm showing this slide, and that is because the censure, the intimidation on campuses, it works. It's very effective. I had a lot of personal emails from people at Stanford Medical School, including in the infectious disease department, saying, keep talking, everything I'm saying is exactly right. I had over 100 medical scientists from all over the country writing me saying, Scott, you're exactly right, keep talking, we're afraid. We cannot come forward. I had a doctor on my block about 2 months ago come up to me and say, most of us at the medical school, we agree with you, but we're afraid. This is what's happening in this country. The trust in America's institutions has been destroyed, and we need these institutions and we need to trust them. The free exchange of ideas fundamental to democracy and a free society is under threat in the United States. We cannot not talk about this. We have to acknowledge it and fix it. It's not a pathway toward this. It's the current situation right now, and it doesn't do good to ignore it or pretend it's not a problem. How do we restore trust? The first step is for the lockdowners to publicly admit they were wrong. I'm doing something more about it. I've started under the leadership of President Larry Arnn of Hillsdale College, a new institute. And this is called the Academy for Science and Freedom. This is the 3 co-founders of it are me, Martin Kulldorff, and Jay Bhattacharya. And we need to fix science. Okay, if we cannot have a society where facts don't matter, science is not based on fact. We just can't have that. So our goal, and we've just unveiled this in Washington, D.C., is to educate the people about the fact that the free exchange of ideas has been stopped, not just by the media, but by science itself, by the people in universities. And there's a reason for that, not just because of their political problems that they are wrapped up in, but because, and I can talk about this informally, but there is basically a cartel of funding research in the United States. People aren't aware of this. The people at the NIH, like Dr. Collins, the head of the NIH, Dr. Fauci, the head of the NIH's infectious disease division, they do all the funding of most of the research. You can't get a university science professor position advanced into like associate or full professor without getting NIH, National Institutes of Health grants. These are, therefore, there's very few young scientists that are willing to disagree with Anthony Fauci, because their careers depend on NIH funding. There's also this unhealthy relationship with private pharma, with a society, with associations with people like Bill Gates, and all these other entities that are controlling the funding of research, the publication of research, and now the public policy. This cannot stand. We have to fix that. Lastly, I'm showing you a slide from the main newspaper of Italy, which is showing that it took 359 years for the Catholic Church to admit they were wrong, that Galileo was right, and the earth moved. I don't think we're going to see that record of 359 years reduced by our lockdowners. They're going to take longer than that, if ever. So to finish here, Winston Churchill said, "Truth is incontrovertible. Panic may resent it, ignorance may deride it, malice may distort it, but there it is." And that's the science. The earth is round, by the way. Thank you.